I'm Dr Soosan Jacob, Director-in-Chief, Dr Agarwals Eye Hospital, and we had this young lady, 44-year-old gynecologist, who came to us from Bombay for treatment last week. She was actively practicing up to 1.5 years back, even doing cesarean sections, but she had been taking treatment for her eyes since the last 10 years. She had undergone multiple surgeries. However, unfortunately, for the last 1.5 years, she became completely blind, was obviously unable to practice, but more than that, even for walking around or going to the washroom, she needed help and was dependent on her husband for everything. She had undergone multiple surgeries and she was told that nothing more can be done for her, and that is when she presented to us. She came to us for an opinion, and we took a close examination at her eye, and we detected that other than all the other problems that she had, which was corneal problems, glaucoma and many other things, we found out that the main culprit that was causing the problem in her eye was the lens. The lens was not fixed in the right, lens was not in the right place. It was pushing forwards against the cornea and the iris, and it was causing all the other damages to the eye. So, in this case, just treating the cornea or the glaucoma alone or the iris alone would not have solved her issue. We had to fix the main culprit, which was the lens. What we did in this case was we removed the lens and we treated it using a new procedure which has been innovated in Dr Agarwals Eye Hospital by me itself, and the name of the procedure is 5F-IOL, and this 5F-IOL has many advantages in that it's a very stable IOL, and it can be done through microscopic surgery. So, we did this, we did the 5F-IOL technique, and then we also reconstructed her iris using the single pass 4-throw pupilloplasty technique, which was also innovated here in Dr Agarwals Eye Hospital. And then we also changed her her cornea, and we did all the other reconstructive surgery that was needed to separate the fused layers of her eye. She was extremely happy, she's doing very well, and currently she's back in Bombay and she's undergoing medical management. She's due here for review in about 2 to 3 weeks time. And I'm sure once she is given glasses as well, after the healing period of about 1.5 months or so, she will be back to very good vision, and she should be even able to go back to her practice herself.